So a few words. Yes, I mean, okay, all right. I'll go ahead and call the meeting to order. We'll start with the pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And please, Father, to come to you, Lord, as your humble servants, trying to do your will, we're trying to do what we think is best for this county we call home. Father, guide our decisions, guide our brains, our hearts, our minds, and our mouths, Lord, that we can conduct this meeting in a professional manner. And we can bring about positive results for the people who go to this meeting. We try to do this all for your honor. Amen. All right, welcome, everyone. It's a lovely afternoon here. First on our agenda is county personnel and public comment. I don't see anybody, but if there are people who'd like to talk, just come on up and we'll make time for you. And I think we'll just roll right through our business. So since you're here, would you like to come up? We can just talk to you first. Well. Okay. Just so people on the other side of the meeting, not turn this around. Might introduce yourself if you would.
Dave Schutz, the maintenance supervisor.
That's all you needed to do. Okay, so there was a few questions and Bill, you had some, maybe I had one or two, and so there's no pressure here. This is just asking you some questions. Don't be nervous at all.
Okay.
All right. And shoot, go ahead.
Got it.
So I'm kind of concerned about when you have, when we have 4 or 5 projects at one time, but none of them go over $5,000. I'd kind of like to know what's going on before we do those projects.
Sure. And he's referencing the concrete. The concrete, we did there's a lot of nice changes, good work out there. It came in chunks that were all under the 5,000 and we add them up. And I looked at the budget. I think we had 6,000 figured for that. And that might be for this coming year. It's in the budget, but anyway, just for information for us, so we're not surprised.
Gotcha.
Go ahead.
So, I introduced myself to you the other day, and so I like the fact that you take care of the courthouse the way you're doing. The courthouse, I think, looks better than it's looked in years. That's my personal opinion. So, hats off to whatever you guys are doing. We want to be involved though, too, with changes. So it's not just budgetary. It's if you have something or you see something, we want you to come in and say, hey, this is what I'd like to do. And we want to make some decisions also with you, make sure that we're part of that. We're trying to maintain a budget. And so anything that is going to exceed what we have in the budget, we try to get on. I know that the 3 of us are going to be more proactive on getting on budgets that go over quicker instead of later. And so we're just asking that you help us. You're one of many, many people we're talking to. I don't want you to feel like you did anything wrong. We're just making sure if we don't tell you what's on our mind, then you don't know what's on, right?
Right.
And so this is a partnership. And obviously this courthouse, like I said before, I think the courthouse is the crown jewel of Brown County, right? So what you're doing is what we want done, and that's making it look nice. So continue to do that. And if you have any questions, we just want you to feel free to come in and talk to us. And so we can actively look at, what needs to be done. But also I'd like to say that since you're maintaining this building, maybe over the next couple of weeks, if you could jot some things down that you see that you think need attention.
Okay.
So we can start kind of planning for that.
Yeah.
And it might be one of those things where you say, well, everything's kind of okay right now, and that's fine. You can write that down too. But I always like looking long-term and short-term. So if there's long-term things that you think need to be addressed, we'd love to know about them now. Okay.
What's long and short term?
Well, just like long-term to me is obviously anything that's not in the budget this year, right? So if you thought, I don't even know what he gave originally, but if he saw some things and said, well, this year we can only do X amount of dollars, next year I'd like to do this.
Right.
That's long-term to me, things that you feel like you don't have the money or we don't have the money to spend on right now. But part of that too is if there are big expenses coming our way, we'd like to start planning for them now. And that way if we have extra money from a different budget, then we can be floating it over. So, and then my last question to you would be, what's the roof like on the building?
Good, because they did, it was just done what, 5 years ago, 4 years ago.
Okay, and we had a
We
warranty.
did actually have this inspector come this couple months ago and
Okay.
walk through. And we did find some problems over at the auditorium building,
Yeah,
and they got that repaired, and actually we anytime now, the guy is supposed to come and do the tuck pointing on, there's a wall that comes down. And it ties into the roof, and there's a bunch of loose bricks and all the, when the guy that came and looked at it said that that's probably the main problem with water. Running down. into
Sure.
the road. And the guy is supposed to, like, say, the schedule will come do that anytime, so whenever, that is another thing.
Okay, great.
But that's on his total thing,
Pardon?
that's over across the street.
Yeah, on our collecting that.
There's also some wood rot over there around the windows. I know that we've been looking at for a
Yeah,
while. That,
yeah,
I think,
and I don't know if that's my responsibility for that, or I've never really done anything.
yeah, well, we actually, there's a guy that did it last time, John Howard, that, I know Tim Winger, who, he's been contacting John, and they've kind of got a plan to take a look at that. So I know it's in the works.
So Tim's on the historical side.
He's on the board.
Yeah.
And,
Okay.
I feel like he does, he and, Gary are kind of looking at the problems over there, and I know that they've voiced their opinion to me a couple times. So,
But Dave said he's not sure, over there with this.
sure,
How do we?
So I went through with the inspector and that was here a while back. And
Yeah.
It was available. So,
well, I guess,
as you say, Tim Winger's kind of does some of it.
well, I know that Tim and Gary both have, done walkthroughs, and they've made,
So I can contact him, but.
sure, he's easy to deal with.
Right, so. And I don't really have anything other than, maybe we'll start trying to see you a little more often in here with some things, things going on, and we got things that we need to be aware of, like Mr. Tessero said. You can come on, in and talk about it.
So he's doing the brickwork, or he's doing the brickwork at that point.
I'd have to look on there. I'd have to look at, again. What his name was, it's, the guy that's. I had a couple, three, tried to get other people to come, and it's difficult to get people to.
That point is.
And that, and if anything, I could say that with the concrete work, it's hard to get even anybody to come and. Do estimates on that. If they do, then they show up and then, and then they don't. Come back with it.
We understand the dilemma, yeah.
Yeah,
It's sweet, but you are doing a good job.
and I will say that probably here. Soon, we need to probably look into the air conditioning. And that on. And that's another thing, I've had people come and look at it. And no response.
You think it's just aging.
Yeah, oh yeah, it's getting to the point where it's gonna be happy, is it's that, it's.
You remember when it was done?
But some of the, like the ones on the second floor, are actually newer and have been replaced, but the ones on the third floor and this floor are pretty bad shape, probably. Could be we didn't have any troubles this year with them, but we did actually have a little trouble with the chiller that was just can't repair it, so, but
Okay. Is that what, so we've talked about the old, a little bit, but are they air conditioned people?
they do pretty much everything, air
They're
conditioner,
mechanical.
plumbing, yeah.
Yeah.
Electrical, I do about everything, and I think that's why they do everything here, because they can't find anybody that works on these units,
Okay.
around here with stones.
Yeah. No, that's a good heads up. That's an expensive heads up too. Okay.
So,
Anything else?
No, I think that was
Dave,
great.
really appreciate you coming in.
Hey,
Thank you. All right. Okay, it's 1:09. Betty, you got something for us?
All right. Yes, Mr. Tessero had asked me for some delinquent information,
Oh.
and I was hoping for a work session on Friday, because I wasn't coming down for the crazy fair. So this is just a rundown, the bottom number here, this is delinquent personal property,
Mhm.
and as I have mentioned, you look at the dates. They're all old, that's where we could do some kind of a resolution. I would like to, it's mostly tax, it does include some real estate.
Mhm.
Amanda and I were way off, but the figure that you got was closer to the 3 million. The information behind before was more close. This is the last page of the report. I just put it on top, just said like simple.
Mhm.
But this gives a breakdown, like taxing in 004 is the city of Hiawatha. So this shows, this is what the city is missing out on their distribution because of these taxes. I think, 03 and, rest. So I'd have to look them all up, but it just tells you the different tax units as to who's missing out on their distribution with these delinquent taxes. And the totals are over here.
Okay.
And this does include, yeah, that's your final
That's
total.
the number.
That's the number. It is still kind of a rounded estimate, but it is a number. It's supposed to have the interest and fees that you see, they didn't all whole on this sheet. I was talking with Almentum, trying to get all of them to pull through, it's so you can see some of the kind of. And it is front and back, all of these are front and back pages. But. And then specials are where mowing, demolition, stuff like that are on, so, but I just wanted to get you those numbers, so.
I think when I talked to you before, you were thinking it was just under. And
Yeah, it's like closer to 3. I wonder if the report I got you before had the interest and fees in there too, and I
Oh, it's
put
a
the
lot.
2.9.
Number.
Well, Amanda and I, because when he came up the other day, and Amanda like, you thinking it was higher than that, so, and we both had the same thing in our head, but this report is telling us not, and like I say, that says PT, that's personals. So, anyway, I just wanted to bring that down.
Since you're here, do you have any more questions?
no, I appreciate it. Thank you.
How's Glenda Osterman? Is anything?
They are waiting on some more information from me.
Okay,
I've been kind of slow on that because I'm trying to get into the new tax roll that we've been working on, and I told her, I said, I'm gonna be slower. Do you need it sooner than later? She said slower is actually good. She says, we've got a bunch on our plate right now, so as far as working with them for,
excellent.
but yeah, we're running reports. I've got to get
Okay.
some more information to them.
When something happens in that front, would you let us know?
I will.
Just for fun. Just
Yeah,
keep us
yeah.
up to date.
No, keep you guys posted.
Great.
All right.
Thank you.
Thank you very much.
Okay. That's a, wow, big one. Did you see that total? 2.6 million something? And change?
Close to 2.7.
Too close to 2.7? But that has every taxing entity share of that.
Including personal property tax.
Including personal. Okay, and but that also has. Did that have the fees and the charges and everything against it? I think it did.
Yeah.
That's what I'm thinking of, what's on.
Too much, yeah. Yeah, okay. All right, time is slipping away. Again, if you had something to say during public comment, we can probably get you worked in. Back in Dallas, so you know, our county counselor is going to attempt to sign in around 1:15, so that's about any time. Okay, let's roll on down the line. The first item is our minutes from the 13th. Yeah, I'm sorry. That's the 31st. That's okay. That's okay. Anyway, okay, we're looking at the minutes. I read them. I liked them. Anyone have any additions, corrections, or comments on the minutes as presented?
I do not. I went through them. I mean,
Okay, if not, then motion to approve. And we want to make that motion?
I'll make a motion to approve the minutes.
Okay, is there a second? Moved and seconded. All in favor, say aye.
Aye.
Aye. Okay, motion carried. Good job. All right, I like it. Okay, next is this local emergency planning committee membership update form. We added Mr. Pollock on page number 10 or whatever. He's very last, yeah. Yeah, and he's the elected official. And I noticed there's quite a few that, well, there's just a lot of good people on there. You should be in good company. We meet once a year to discuss all things emergency preparedness. And is this just information, or do we need to? And so I looked through all the names and I knew most of them. Did anyone have any concerns over this as presented?
No, so obviously each one of these had asked if they replace somebody. So we haven't really replaced anybody on this, right? It's all just adding members to it. Is what it looks like.
Yes, I don't understand that.
So it looks like the former commissioner is still on there, but he must have went from elected official representative to just community group. So he just changed his designation. And several of them don't have a designation, but I assume we can just like Greg Bevermeyer on the Kansas City radio station, he would be local media. You know, we can just fill that part in. So. Any more comments?
These are all volunteer too, correct?
Where's I know?
It's not a paid position, anything like that.
Okay, well, I'd make a motion in that we approve this document, this LEPC membership update form. Is there a second? Okay, it's been moved and seconded. All in favor, say aye.
Aye.
Aye. Okay, motion carried. Excellent. Good job. We're flying down this thing. Okay. So the holidays, I thought we'd already done.
Yeah, it was included on that on the.
Okay. As a whole. Okay, so we made a commitment to make a decision on this today. We had something on the, kind of in our train of thought. But we're really making great time here. Does anybody want to have any more discussion on this?
I don't need any more discussion.
Okay.
Now, are we only talking about the holidays?
So
'Cause-
this-
Okay,
the
you're
holidays
talking
we've
everything.
done. I went ahead and scrolled down to the
Okay.
insurance. Oh. Okay, so let's talk about that for 26. And what was the participation in the wellness incentive? Was it significant? 14 at, is it $50? 100?
Well, let's check.
15 participants. All right.
So there are two things.
Yeah, if we both did that.
Okay.
Well, the wellness check is, obviously that's what we're wanting our employees to do. We're trying to look at long-term ways of getting our insurance costs down. So encouraging people to go to the doctor at least once a year, those kind of things are what helps long-term. So obviously, I think we want to keep that, correct?
Yeah, I didn't really know it was up for, I just figured it was part of it.
So when they go get their wellness check, do they have to pay it, go pay at the hospital or not? I don't know what it's.
I believe our insurance allowed one, full screen year for free.
Right.
No.
There you go.
But that's typically how it is again, they're trying to encourage people and so.
All right, Dallas, thanks for chiming in with that. Again, you're hidden behind that TV. I often forget you're there. So I appreciate the info.
So that's good. Yeah, I think it ought to continue. 14 are good. It's not good, but it's not.
Well,
And you hear.
okay. Okay, and that's $100 gift card.
I would say in effect.
That's right.
Yeah.
That's right. That's right. Okay. Dallas, just a technical issue here. My light here goes red every now and then. It's flashing red. I don't know what that means on my microphone. Okay. That's never happened before. All right. So as far as the insurance and Blue Cross Blue Shield, Delta Dental, Surancy Vision, Principal Life Insurance. Is there any changes made to that or those numbers? Those numbers are just the cost divided by the participant. That's the math. Is there any discussion on it?
So where does the gap fall into that?
So since it's not there, that means it doesn't exist. Okay, because that would be,
Okay. That would be my main question is,
thank you. Okay, wonderful. That fixed. Question?
Are there any writer comments from employees? Which cut on?
Just been discussed.
Oh. Well,
Okay, so that was my question. I thought we were. Since it's not listed, I just thought we were going to look at the insurance. And we could do that and talk about gap later, but we can do it all in one fell swoop also. However you want to do it. Okay, so. At the risk of explaining things too much, we all know where the insurance is. We know where it's going. I think this lookout the projection that we got in our work folder from Watco is wonderful information. And if it can that be distributed somehow so people can see that? So we, is it?
If someone asks for it.
I just think information like that is very. Yeah, if someone wants it, I'd like for them to have, basically, is what I'm saying. Yeah.
We have an employees only page on our website, so we've been putting some of our documents.
Oh,
I recently put the information about the wellness program in there,
okay.
so that could be a good place for this as well.
What do you think?
Yeah, I think it'd be good.
Think?
You want that final one that you can, the one that's the last.
Is it?
I didn't know that.
Oh,
I'll
yeah.
check emails, right?
I didn't check my email this morning either. Oh, okay. Oh. Okay, according to this email, what I'm thinking is something different. Mine is, if I go to my Dropbox and go back to the work session, no, it's not. 2026 insurance, you've got it so well organized now, I can't find it, so. Self-funding strategy year over year, that PDF, that's what I'm thinking. Where it shows the funding in 2026 to 2030, and it shows how much it goes up. That's what I was thinking.
Is that the one you're looking for then?
This is, yeah. Yeah. That's
In the
exactly
middle,
right.
yeah.
Yep, it's,
28.
yep. Yep. Okay, and, you know, I made that kind of a joke, but really you did do quite a bit of organization here since, I appreciate that. And you got the budgets right there where we can all see them. We got insurance, we got all this. It very well done. That's nice. The only organization I did was I finally pulled some of the budget folders out of my big black case there, so I got room. And you took it to the next level. All right. Austin.
Yes. How are you, Commissioner?
Good afternoon. Welcome to the meeting. Right now, we were just talking about the insurance, what we had presented. Are you in front of a screen at all where you can see?
I am.
Okay. Well, we're just on it's page 10, and it's the 2026 insurance rates. So that, when we last visited as a commission on Friday, we talked about eliminating the county's gap coverage. All right, continuing to fund insurance at the same levels. I mean, the dollars are different, but you know, we pay 100% employee, we pay, you know, so on and so forth. All those tiers are the same, but we're gonna eliminate the gap, and that's sort of where the discussion ended when you popped on. So,
Hey. So I have some thoughts that I want to maybe just share for thoughts here in terms of what the problem is, and maybe this is just an overall. I'm not trying to sound like an echo chamber for what the commission's facing or what all's going on, but I want to share some thoughts here as you guys are wrestling with this. Okay, because we just talked about this in Nemaha County yesterday. Okay, now, and I think there may be some opportunities to collaborate on this, but when you look at what we're dealing with right now, we've done the right thing in that we're self-insured with a linebacker payment. You have to do that to have any potential future negotiating power. Okay. Now, when I look at structure of benefits, I look at what the cost is long-term for the employee and the employer. You know, there's maybe an option here where you can say, look, if you want gap coverage as an employee, you can buy that. And we can give you a flexible spending account or a health savings account to allow you to fund that pre-tax. But you have to draw a line somewhere, and that's $90,000 this year. If I remember right, it's about $90,000, if I'm remembering. Okay. But at the same time, okay, we're at 1.1, 1.2 million. Now, we don't have a lot of drive from pressure that we're putting external pressure and internal pressure on what it means to have reductions in health insurance costs. That's not something that's usually transparent to employees from even a mid-sized employer, what that looks like. The problem is right now, we were on a full coverage plan. Every year, it takes 15 to 18 months of an insurance premium increase. That's why right now, if we went out today and we got quotes to go back, and we did this, you saw it. It was slightly cheaper to go back to a fully insured plan this year. But next year it will not be. Okay. Now the goal is, how do you maximize, and this is part of what I was talking about in Nemaha County yesterday. How do you maximize the available benefit to the organization for having a good year? And what does that mean? So if you have a good year in claims right now, we have about $1 million of our insurance premium that goes into funding claims. And last year we had a heavy year, and so we used most of that. But the problem is that if you have a good year, that $300,000 to $400,000 or $500,000 we lose that if we go to a fully insured plan. I'm saying this mainly for the benefit of employees, but also for putting this into perspective. Okay. The goal is in year 5 to 7. And I say all this, you didn't have the benefit yesterday of seeing the Nemaha County benefits assistance person nodding her head while I was saying all this, but just in the background, there's a nice lady nodding her head about what I'm saying on some of this. So I would suggest what happens is that you try to get that savings up, and you don't do anything for the first 3 to 4 years with what that savings look like necessarily, because you then have about a year worth of linebackers. And the idea is that maybe it doesn't happen next year, maybe that doesn't happen the year after, but after that, you're absorbing the 15 to 17% increases without passing that on to the taxpayer, because that's a mill. At that point, it's a mill. So you're saving functionally by doing this a mill. That's the first thing. So right now, you are having one of the top 5 most important conversations you can have for the county's tax future benefit in this meeting, right? And it sounds dramatic that I set that up, but it is accurate. You are having one of the top 5 most important conversations you can have. Now, as far as that goes, within 3 years, you sticking with a self-funded plan, if everybody focuses on maximizing user efficiency, you are saving yourselves a mill every year of an increase. Now, there's some other techniques that we're talking about in Nemaha that we probably want to discuss. Blue Cross Blue Shield charges 1.2, 1.3 million. I guarantee you that they are not paying out $1.3 million. They are making money off of insurance premiums. Now that's their job. There's different negotiation levels with each institution. Blue Cross and Blue Shield was so delinquent on payments with the Hutchinson Clinic out of Hutchinson, Kansas. They were a year behind negotiating payments with them that Hutchinson dropped them for a while as a carrier, as an insurance carrier that they worked with. Now they went back to it, but they were delinquent. There's different rates that happen in terms of where you're at from hospital. Now, eventually, in 2 or 3 years, and this is something that I think the commission, myself, probably in a lead with Commissioner Richard, we're going to work through some structure on this. But the reality is, in 2 or 3 years, maybe even as early as next year, I would like to see us have something sort of like Medicare Advantage, okay, with our local providers. And Medicare Advantage, the reason I bring that up is Medicare Advantage is like Medicare Part G. Okay. Now, this doesn't need to change employee access. In fact, it's designed to improve it. But with all of our, like the Sabetha, with Amberwell Health, okay, as a front line of defense. Within the insurance context, right now, I still have to pay a $25 deductible out of my pocket to go see Amberwell Health, or $75 to see a specialist. I don't like that. Particularly in our environment, I think those visits should be free. All right. Now, being able to negotiate directly with the hospital means instead of paying It's kind of like if I have to have a procedure. I had a procedure, fully recovered, thank God, but I had a procedure that I paid out of pocket for versus insurance because it wasn't covered by insurance. It was 4 times less, or actually 2.5 times on that procedure less than the insurance coverage rate. And by establishing those direct relationships with our local providers and saying this is where we can and where we should be at, right? Then we're able to cover that and we make money on the front end of the claims. Now, this doesn't change the ability to go to KU Med or now I bring that up. I use only KU Med because that's one of the restrictions if you have and I'm thinking about Kansas City service provision. If you're using Blue Cross Blue Shield of Kansas, because they break up the network so that Blue Cross Blue Shield of Kansas and Blue Cross Blue Shield of Kansas City are separate, it's hard to get access to like St. Luke's. And that upsets me a little bit because St. Luke's has, I think, a better neurology department. And if you need a heart transplant, St. Luke's is a little better. Okay. So that's usually, believe it or not, Aetna does that a little bit better than some others. So we have to talk about whether that's good or bad or ugly. But the reality is that if we're doing this in the right way long term, I think the goal is how do we get better healthcare coverage and still manage or reduce our costs and control the conversation. Now, I think direct primary care was brought up as in a prior meeting about what that looks like and what that means. I like direct primary care for a number of different reasons. My wife is a physician, okay? But direct primary care goes back to the idea of how do you end up with someone that you don't have to pay the 25 or the 50 or the $75 copay, but you're on a monthly payment where you get access directly and you don't have to think about it. Whether that's 50 or $75, because that's usually about the range, about $75 for a primary care physician. But if you take that and spread that out per employee across the county for direct primary care, first of all, we're doing a good turn by the local physician because they get whoever we partner with, they get the benefit of those direct primary care relationships. They also don't have to worry about negotiating back and forth with insurance because what happens is that they see a patient and they bill for X amount, but they have to go back and forth and negotiate it back with insurance. They get to rely on that as an income stream. So that's not all bad. Also, and we don't have this all mapped out for this year, but you get better healthcare outcomes because you're able to see your physician more regularly. You don't have to worry about the copay. And the goal being out of this, yes, the county is trying to control costs on insurance, but if we're really smart about how we deal with it, I think we can get a better care premium product than what we're getting with just a regular insurance product. To prove that point, there are several companies like Quick Trip. I'm using them as an example. In the Kansas City metro, they're so convinced by direct primary care, they opened their own clinic to do emergency direct primary care. Direct primary care is the fastest growth sector in the Wichita market. They went from 5 to 7 years ago on the direct primary care side. I don't think anybody was doing it. Now, I think I'm trying to remember what the name of the group is. They have over 30 providers in the direct primary care practice on the north end of Wichita, and they service medium to large size corporations. Now, what I'm hoping that we get to, and what I think we can work on strategically together over the next 9 to 12 months is, okay, this is where we're at this year. This is what we have to do budgetarily wise over the next 3 to 5 years to make it so we're not increasing mills for healthcare coverage, right? This is our goal, to have a lofty goal, as little to no out of pocket for the employee as possible, and still have the maximum amount of care options available. Support our local economy with local physicians. And if there are physicians that we're not working with directly yet, contact with them. If an county employee is seeing somebody, let's contact with them over the next 9 months and get them into what that ecosystem would look like. And then with the goal being, how do we map out in year 3, 4, and 5, we get to a position if everybody is really working hard, and there's some things you can't control. God forbid somebody has cancer, you can't control that. You know, you can't control, there are certain things I believe in the Almighty that God controls and that we are subject to, but there are certain things that we do have some discretionary control over in terms of the type and the number of usage. But if we control that the best way that we can and we put some of these tools together, we should be able to come back with better insurance options that cost less. And I'm seeing it work elsewhere. I don't see a reason why we can't try to do that here. So this is a long-winded way of me saying, yes, you are taking a step to reposition $90,000 in your budget that eliminates the gap. This is a way, though, an opportunity for this year to figure out, okay, this is step one. The goal is we want to have something in step two that returns back the same, if not better function over the next 9 to 12 months and come back with some options. Everybody's going to have to be flexible on what those look like so that we can get there. But we need to have a leaner, meaner way of dealing with insurance that gets employees the best optimal value available. And I think we can do that. That's the conversation that's going on in Nemaha right now. I think we can collaborate with that. And we've got a good hospital system locally that I think will want to work with us in that way as well. I'm going to stop talking.
No, I 100% agree that, what we're doing right now is we're taking small steps, but we have less than a year before we're right up against this thing again.
Mhm.
And so at least with direct care, at least there's something that we can start looking at pursuing that could possibly lower, like you said, so that we don't have to increase insurance by a mil just to cover our insurance cost. We're not getting better insurance by increasing. You know,
No.
the coverage is staying the same and sometimes it's going backwards. And we're just chasing these premiums.
Yeah.
Do we look attractive enough in your experience, and you're dealing with this right now, but correct me if I'm wrong, Nikki, do we have 59 participants in this plan right now? There's approximately 60 participants in the healthcare plan. Is that a large enough number that we're attractive when you try to go after direct care?
Yeah. It's attractive. It's a mid-sized insurance pool, and it gets even more attractive if Nemaha and Brown are looking at the same thing at the same time. Not that we have to do the same thing by any stretch of the imagination, but yeah, then you've got over 100 participants. The market, if you were looking at this 5 years ago, I would say that's a very difficult thing. But no, the market has shifted towards direct primary care. Physicians don't. I'm going to sound like a healthcare administration nerd because that is a hat that I have worn some in my life, so forgive me. Okay. The problem is that if I want to treat somebody underneath CMS regulations for insurance, I see you and I have to bill for medical grade complexity as a provider. I'm sorry, I'm going to sound like help. I'm a lawyer. Just forgive me. I guess that's why you hired me, right? But the reality is I need to bill medical complexity, which means I have to document that I saw 4 different issues in a sick call visit to be able to bill CPT code 99214. And 99214 is a complex office visit for an established patient. That is approximately $147 in a quarter to bill, somewhere in that range, if you are an office provider. When that office provider sits down to do that work, they don't know whether they're going to see you for 10, 15 minutes or an hour. It depends on how complex you are. Then after they're done with that visit, okay, they have to establish a report that charts out that justifies 4 levels of medical complexity. So my wife deals with kids, pediatrics, and she's very complicated because kids can't tell you what's wrong, right? My brother's wife deals with the opposite end. She's a physiatrist. So she deals with people that are in aging positions that have a lot of medical complexity. Both of them spend 2 to 3 hours a day charting in the administrative suite. So it sounds like a lot of money flows in and out. And it's not a bad business model, but the reason why all the independent practitioners are selling off the larger practices is because you can only see so many people a day. And there are people in the office, your administrator, they don't make you any money. Your nurse, they make you a little bit of money when they give shots, but it's not a cost neutral. So what's happened is, particularly in rural markets where we're at, a lot of practitioners just shut down or they can't sell because the money's not there. Or many practitioners say, I would rather just work on a per diem basis with a larger provider and turn over my patient pool. I don't have to deal with all this. And there's no retirement for them. So the model that's shifting in the market is they would rather do direct primary care. Now, the reason why that's attractive to a provider, let's say you're at $75. And let's say 50 of that goes to the provider for running it. 50 times, and I'm just doing some quick math here. Okay. When you're, so that you know your leverage within it, 50 times 120 times 12, right? That's $72,000. Now they can't make a full living off of that, don't get me wrong. But that pays for a nurse and half of the reception front. And it allows them to see a normalized volume of patients. So it is attractive, but you've got to work with people. You're probably going to find one or two people that want to sign on for you, right? They're not going to make a killing off of it. It's not like they're going to make $1 million off of doing direct primary care. That's not how this works. But the idea is if they have 300 or 400 people that sign up for direct primary care, that's better than them having to sit there and bill all this medical complexity and document it. They don't have to submit it all. They don't have to have this claims adjuster. They just have. So the sweet spot, which is really kind of what you're asking, is when do we feel really good about things? We feel really great about a size if you're at 400 to 500. Okay, because if you put 400 times 60 times 12, it's $288,000. Which then if you get rid of all of the administrative overhead costs that get eaten up by that and you add in shots, that's roughly about where a practitioner needs to be to say, I'm not doing insurance. They would want to be at 500, okay? But at 500, so I'm saying at 120, you look like 1/4 of a practitioner's practice. And that's enough to negotiate with, so it's attractive. At 60, it's a little more difficult, but there are people that are interested in already doing this. And you're looking for a couple of people that service 20,000 people. 20,000 and 20,000 potential pool between the two counties. So it's there, it's available. That's how I look at it. Was that helpful?
It is. So how do we, I mean, we're practically to 2026 right now.
Yeah.
So how do we jump on this next year early, or how do we come up with some sort of a schedule? Because the last thing we want to do is let the first 2 quarters go by and then start looking at this.
Now,
Correct.
what I would, yes, we need to do it early next year, and that's what I'm doing in Nemaha. I think we can walk and chew gum with this over the next couple of quarters. If we don't have a plan running into April on what this would look like, what we need to do is we need to sit down, and I've got contacts at the Amber Well Health System, sit down with the hospital, and then we need to talk, make sure our employees have identified who they're using right now as primary care in county. Okay, so that we have the conversation with them or in the adjacent county, right? We identify who's being used so that we don't leave someone out of the conversation. And we say, this is what we're doing. This is what we need to be able to do. And that direct primary care is just the front line. Okay. We still have an insurance product that deals with, and we're still insuring for your specialist. We're still insuring for we're not able to wrap all that up yet. Now there's some options out there that we could do a lot of that remotely, that I even had a conversation. I was approached to understand more about what it means. That's possibly tax advantaged in a very good way for the employee. So it actually saves them and the county employer money from a tax standpoint to have this secondary distance option for specialists. right? That's another zero fund dollar option. So I think if we work on that, I think what we try to do is come back in the next 2 quarters on a schedule. This can be I know I'm tasking Commissioner Richard, probably and I to work together on something here that is kind of a heavy lift. But if we do a little bit of this in the first quarter of this, and we sit down with our insurance provider, say, this is where we want to go. We have our employees identify in the first quarter, these are the people they're working with. We have some of those conversations, and then we come back with a plan, action date by April 1, that this is a potential 2 or 3 ways that we can start introducing this year. And it can be phased, but we say, look, here's a couple options that improve employee health care. Because I think that should be our goal, is how do we do this and at least maintain, if not improve, employee health care availability. So I think we could come back, and if we said, hey, we're going to do that in the first 2 months of 2026, that's a good goal. That gets us through the holidays. People come back. It's a heavy use time for the providers because it's cold and flu season, but it gives us a little bit of time. With the insurance, we start that conversation then, and then we talk to the providers in late February when things calm down a little bit, and that's how I'd do it. Good question.
Okay, so long term, I think we see a vision here, maybe a strategy, what we're looking for. And I
Yep.
can picture it, but from where we are now to where we want to be, our step is what's in front of us is the 2026 insurance rates. That's
Right.
what we presented, the self-funded strategy, nothing changes. I mean,
That's right.
we're good to approve that and roll on to next year. But as far as the county and the gap coverage, the first step towards us moving to like this direct primary care, this sort of model you were talking about, is to go ahead
Yes.
today and to go ahead and vote not to have that anymore. Is that correct?
Yes.
Okay, and then so that I would assume, now you tell me, 2026 insurance starts January 1. Does the new gap policy start January 1?
Yeah, I think you're heading into open enrollment. If you're going to pull the trigger right now, it's a good time to pull the trigger, and that gives you $90,000. And I want to say this: there may be some opportunity to start some of this. You've got $90,000 there. Okay, you're going to need some breather room. That $90,000 may be very important in 2026. Okay. You give the employees the opportunity to spend on their health savings account right as they're getting ready to start. See if they want to go on ahead and contribute to that gap coverage. See if it's even available. I'm not sure that it is on an individual basis. We may have to do it for the entire county or not. But I think right now you're going to need some monies to deal with making it work in 2026, what you're trying to do. And the $90,000 is the step. To be clear,
So
yeah, that's what I would do.
can we make basically a concurrent motion to approve the insurance and to discontinue the gap policy, and that's effective January 1?
Yes.
That how we would do it? Okay. Okay, and then
Yes.
the 90,000, that's not like money we have rat hold somewhere. That's just the
No.
projected savings based on usage in 25.
That's right. And I
Okay.
think what you're looking for with the gap though is if you're running into 25, in your mind, you're saying that is half of what the projected increase is for 2026 insurance renewals
Okay.
going into 27. So what you want to do is we are on a score sheet here. We've maybe tackled half of what we have to do to not have a mill increase next year. And this is only for 1 year. So this buys us 9 months to figure out what this looks like so that you don't have annual increases.
And so from looking for positive outcomes for commission and for the employees who get the healthcare coverage, we're looking on the commission side, it's monetary. And if we can, as I understand you correctly, if I understand, the direct primary care model should lead to better health outcomes. And if it leads
Yes.
to better health outcomes, that should put us in a better position to negotiate with Blue Cross Blue Shield as far as our premiums. Is that right?
Yes.
Okay, and then if it leads to better health outcomes, then that model, I would assume, I'm not sure how to ask this, I guess, but if employees would have to, it would be with the direct primary care thing, is that voluntary? Is that?
No, that would be
No.
forever.
Hmm.
So,
Okay.
well,
Yeah.
Yeah.
Everyone would have it. Everyone would be enrolled with a direct primary
Right.
care physician.
yes. And so what that would mean is that I could still use my insurance coverage to go to a specialist. or go seek a second opinion or whatever. But I'm gonna
Okay.
have to pay $25 every time I do that. What I'm
I see.
suggesting is get rid of the copay. Now, it sounds illogical that I am saying that you can do more. You're making a decision right now because you have a very tight budget. And I
Right.
can, from an administrative support perspective, very much respect that because you just absorbed a very large mill increase. Okay? What I'm suggesting is that the model that the Affordable Care Act that Obama pushed through has driven us towards is you have to identify alternatives for your low to medium level claims. There isn't any way that you can financially sustain doing full insurance coverage, and it's not going to be great if you don't have a direct employee intervention model where you're negotiating rates out, even on a self-insured model. You have to start doing that because, and if you don't do that, the reason why this doesn't work is if you were buying insurance openly before Obamacare came, you had a 6-month waiting period for excluded conditions, and the cost was 1/3 of what it is now if you're buying insurance. There were far more people that were available in the marketplace to buy insurance from. There was a lot of competition. That competition dried up with the marketplace. You had all these independents that would play all over the United States. Now it's down to 3 people in the state of Kansas. And for a while there, we had 1. And many states had 1 or none. And so the federal government had to go ask people to provide insurance in that state because it is far more difficult and more expensive under the Obamacare regime to provide insurance. So without the lack of competition, now why is it more expensive? That question's a little beyond me. Is it a lack of competition? I don't know. But right now, the only people that are left are giant insurance providers.
Okay. You have
That's
a
it.
question, Bill? No? Any more question? So,
Nikki, did you have a comment?
So we're gonna offer savings accounts, but when we get to the RMD.
can you hear Nikki?
can't hear
speaking?
I'm sorry.
Okay, so the concern was maybe the clear understanding of the county's gap plan currently. Do you have any questions about that? It's all in-house. So Brown County self-funds its gap coverage currently.
Okay.
Okay, so is that different than what you had on your mind?
It's different in that the savings are realized because it's budget savings that we're funding that right now with. And so you're actually having this funding available. So that is different than what I understood.
Okay.
The other thing is that with our employees, do we know how much annually that is per employee, Nikki? Is that like $250?
There's not
So it's what it is, and I'm going to do my best here. So there's a $5,000 deductible. The employee pays for the first 1,000, and then the county picks up the rest, the remaining, reimburses the employee for the remainder up to $4,000 more.
That's
Okay, and is it different per family? It's a little different. Yeah, so for a family, it's a little different. You know, the family pays the first 2,000 and then the county reimburses for the remaining 3.
And am I correct in saying only about 40% of our employees participate in it?
So in 25, as of last meeting, there was 23, I believe, for a grant that employees that participated in gap coverage in the amount of $89,000. I think that's right.
That's correct.
So it's a flexible amount of money year in, year out. I believe you can chart it. You know, you would have records of it for the last 3 or 4 years, but is 80,000 a year, is that rough?
That's better understanding. Thank you.
Okay. Well, that's all right. That's all right. There's so many moving parts to this. So, okay. And then you said something about, are you wanting to start an employee a flexible spending account program for 26?
I think that opening that option immediately is a good idea.
So,
Okay.
when we do this, if we continue forward as such with the insurance and discontinuing the gap, what's the process to get a flexible spending account? I mean, how's that get set up?
So it takes, this is the time to do it if you're gonna do it, because you can do it by next meeting. If our insurance provider can't assist with that, the one in Nemaha can. But it's either Surancy that you'll use, or you'll use, there's a different provider that'll do flex spending. But the reason you do that, if we don't already have flex spending, is that employee. Okay, so there's a certain sharing event that happens when you have employee, when you're not covering $1,000 deductible, or when you're not moving the deductible from 5 or 6 down to 1,000. Okay. And so what that flexible spending account is designed to do, it is designed to make all of that pre-tax expenditure on behalf of the employees. Okay. So what I will tell you is, the county was very generous with $1,000 deductible. There's a reason why the flexible spending accounts exist up to $6,000, $6,500. Designed to pick up a majority of the costs pre-tax off of an employee deduction optional that come if you think you're going to have a heavy usage year on healthcare. All right. The deductibles are designed by the insurance company for an insurance for a level of claims resistance or claims exposure. The deductible and the co-insurance amount is used by insurance companies to control usage directly. All right. Now, there's a reason why you have a maximum out of pocket with a certain level of coverage, and the county has, from its renewals, I can see a very healthy level of coverage. Okay, and that's good. That's part of what government employers do better than on the private side. We provide better coverage, and that's there. I've worked with a lot of different governments. I've never seen a co-insurance to the $1,000 level. Post-Obamacare. Pre-Obamacare, yes. Post-Obamacare, no. The closest is Cheney, Kansas, and they have a grandfathered plan that functions like pre-Obama. So,
What you're saying there is in your experience, working with a lot of different
yes,
entities, you're saying that Brown County's the most generous that you've seen as far as this deductible.
yes, and I will go further. My wife works at a federally qualified healthcare center. She is their pediatrician. Okay, so they have a basic coverage plan that is not as good as the county's coverage plan. All right, they then have a buy-up plan, and to buy up for the family, to get the equivalent coverage with not the $1,000 deductible, but the $6,000 deductible that you're looking at right now, or $5,000. We don't even have $5,000 deductible with her. $6,000. We're not on her insurance at this time. When we were on her insurance, we get to the $6,000 deductible, right? We paid out of pocket $2,100 per month to buy up to that level. So to get a $5,000 individual deductible with like a $10,000 family deductible with her, we paid $2,100 and some change at the federally qualified healthcare center, which is literally the free clinic. So as far as benefits go, they would have now there are some healthcare systems, but she worked at Children's Mercy before, and insurance was a little bit better and a little bit less expensive, but she was at a hospital working, and your benefits are just as good as hers were there, and they're less expensive still. So I'm saying that right now, where you're at in the marketplace, you are in Brown County. Yes, it's a little different than Kansas City, but my wife works at the third least desirable place to work in terms of money as a healthcare provider in the metro. and her insurance benefits were $12,000 less beneficial to our family than yours are after you remove gap coverage. That's so I can't, I'm not telling you it was bad to do that. I'm just telling you that that's your reality in the marketplace. That's my job from an administrative support standpoint, is to tell you where you stand in the marketplace.
Are there
And
restrictions, Austin, on this FSA, this flexible spending? You said you could do it
No.
right now. What, can you do it in January? Can you do it in February?
yes,
Okay,
yes, you need to do it. You need to do it now before people do open enrollment. You need to start it now.
okay,
We have an FSA through further
we do.
health equity and employee only contribution. And I think it's like 3,000.
It's active right now.
Yeah, you have to enroll every year for it or not.
Okay, and that's an employee-funded program, and that's by choice. I mean, they decide to do it, and they just take so much money every paycheck, and it's pre-tax.
I believe.
Okay, so what Nikki's telling us is we already have an FSA framework. Health equities. So we already have something like that in place.
Mhm.
So.
This makes sense to me.
Okay. So what I was trying to do is, because you're giving us a lot of information about a very complex topic. So
Yes.
I'm trying to do like an insurance flow chart, a time lapse here. So, and I'm going to go back to today, because on our plate today is to approve the 26 insurance as stated here on our agenda. All right, part of this process is to work on this gap policy, and that's to
Yep.
eliminate the gap policy when we approve the insurance. Okay, so then my next was to start this FSA process, but we've already got it. So somehow we
Correct.
need to explain to employees that we have this. So when they do the open enrollment, do they need to sign up for it? Add open enrollment? Is that the only time they can do it?
I believe so.
Yes. And you can set up, if you're self-employed, you can do one at the end of the year, but that's not how we work.
Okay, and so then we need to advertise that we have this flexible spending account already, but we need employees to know so they can sign up for it if they so choose. But then the next step is I just put research and interview direct primary care facilities or people, or I mean, is that right? Maybe I missed a few steps in between.
No,
But
you're right. That's right.
I'm trying, the immediacy of it, the thing we need to do today is the first three.
Right. And you can do that. All you have to do right now today is just approve insurance with the discontinuation of the gap coverage. That's a fine motion here.
Okay.
That starts you down this path. Yeah,
Okay.
I would also make a comment about, yes, there's some sharing in cost here. I do think that from administrative support perspective, as you're looking at this, you're dealing with a tough topic. This is everyone's lives. Everybody looks at that, but I think you're doing this with the expectation that you're looking at options to improve insurance coverage moving forward while still recognizing your budgetary constraints, right? And so you've got a reason why you're not just slashing and dashing. You literally are looking at a way to control costs, but you're working in the next several months to come back with a way to make better, if not improve, existing insurance situations. I would make that note. Does that make sense? Yep.
It does. And so we all have our own personal experience with healthcare.
Yep.
I am enrolled in direct primary care and have been for several years now. We purchased insurance. It's a sharing type insurance because 10 years ago, we had to get out of it because it just got too expensive. So I've had tremendous success really with direct primary care in lowering our costs. Now we pay a monthly fee, but if I need to see a doctor, I just go see them. If I need an MRI, they partner with somebody in St. Joe and I get an MRI, and it's very cost effective. But what I'm hearing from you is part of this process will be the interview of people around here. You're trying to stay in county. So
Yes.
Amberwell would offer a lot of these same services. There's an opportunity possibly to work with them, the local hospital, to set something like this up.
Yes.
And that's beyond just like the initial concept. Someone's been in discussion and.
Not yet in formal discussions with them over what that looks like.
Okay.
That's
But even the
next step.
idea of it, has the idea been presented?
No, it has
Okay.
not yet to them. But direct primary care is an idea that's kind of going throughout the state of Kansas
Okay.
at this moment. So it's not going to be a foreign concept, but we don't know where they stand on it yet. That's the
Okay.
next part of the conversation.
So I'm trying to ask questions as if I was receiving insurance from the county. And
Yes.
I look at this and think, well, there's some question marks in my health insurance. And I'd like to have those answered. So with the timeline that's laid out, I mean, it helped me understand it a little bit, but from our side today, I think I know what to do. We'll be in contact with you in the future, in the near future, about trying to, get this ball rolling. Was that fair?
Yeah.
Absolutely. Okay. Okay. All right.
Primary care for 26 or 27.
So we just had the question, are we looking at primary care for 26 or 27?
I think we're looking at it right now for 27, but there's potentially, depending on the savings, what that looks like in 26. We don't know yet. We're going to find out what that looks like here, but I think it's probably going to start January 1st, 27. We just don't know yet. We don't know yet what the budget's going to look like with it, but I have a feeling it's January 1st, 27 that will get everybody in place. It takes healthcare months to do things that sometimes will take weeks. That's just healthcare.
But it sounds like, first quarter, you and I possibly could start having some meetings and start looking and then reporting back, correct?
Yeah, yes, absolutely. And I do think, I don't want everybody's hopes to get up too fast, but if I had my rathers, right, Nikki, on your question on the direct primary care, if I had my rathers, and I'm not trying to commit the commission to doing something because we haven't even looked at the numbers, but if I had my rathers, we try to get something done as early as 26. Later in the year to see so that we have some position that starts to structure if it can make financial sense. But it's got to make financial sense. It'll make some level of financial sense in 27. Okay, but it may make some financial sense and the cost may be limited. If we, I hate to say this, but also as an organization, it looks also if we've done really well with our claims usage, right? It seems weird to think about this, but quite frankly, insurance is like anything else. If I use it really hard, then I've got an issue at the end of the year. But if I haven't used it in August or September, I've only got 3 or 4 months of linebacker coverage there. We're able to sit down just like we did at our last meeting with the insurance company. And they said, I don't think you're going to have as heavy a year, right? If we've tapped out our self-insurance pocket, we don't have a lot of flexibility, but if we have a really great year, we can probably figure something out towards the end of 26, as long as we're all, does that make sense where I'm going with that, commission? Like it's kind of on us as a collective community to figure out, we can't control certain things, but hey, we can do something. That's all I'm saying.
I mean, I think I understand it. We could have talked about
Yeah.
insurance for a long time.
Yes.
And we will, it's coming. So is there any other question? Whistle. All right,
Nikki, you need that? Okay.
yeah, okay. No question. All right.
Appreciate looking at what you're saying. I agree with what you're saying.
Okay, so I know your time, I'm sure, is limited. Anything else you would like us to know before you need to bounce off? Or are you good?
I think right now there was I guess this is a segue because we just outlined another longer term thing that I'm going to probably work with directly with Commissioner Richards. I think there's a conversation that I'm probably going to bring I don't know how we feel about, we've talked a little bit about where things are at in terms of some administrative support for some of the structuring and optimization that's going on. Okay. With the idea being that right now in the next 12 months, we're going through a budget cycle. And you guys are in a budget and an operational cycle where, we have kind of a changing of the guard in terms of operational, there's a lot that goes into operating a county unit of government. Okay. And a lot of it is road and bridge, a lot of it's structure, a lot of it's supporting some county operations that are going through kind kind of a lot over the next 12 months. We're about to run into midterm elections, which is a heavy time. Although the federal elections seem like something that's robust, our midterm elections are probably even more in some ways robust because we have all the state offices that are coming up and the federal races that, there's some burden on, I'm just picking on one department, so please forgive me for that, but that's just one department in terms of burden, but you're going through a process where we're looking to optimize and streamline a lot of different county administrative operations. I happen to have some background to assist in that. And right now, in doing that with some of the meetings, there was we're kind of extending some of our meetings into more long-term workshops, with the goal being that I think probably in a year from today, 12 months, I don't want to put like a timeline on how long you guys meet, but you guys are getting ready to do some operational meetings even in between, with Nikki providing support. So you guys can sort of speed up the conversation to make some organizational improvements happen. I think in that, we're probably going to talk about whether there's some desire for some additional administrative support to buttress some of that. Right now, I've spent on average between 15 to 20 hours in the last in the period of time I've been with you guys, which is fine. Okay, on a monthly basis, it'll calm down a little bit, but I don't think every county has its rhythm. We're definitely not in Nemaha County. That level of support is not needed. We're fortunate that we're not there in terms of some of the mechanisms and how much restructuring and support is going on from a cost perspective, although there's always benefits with some administrative support. But reality, there may be some administrative support that's desired. And so what I think maybe for next meeting, since I'm not there in person today, but maybe there's some conversation that leads up to that about what a short addendum with a few additional hours a month would look like if I'm able to provide some back-end support to the commission as they execute sort of this restructuring.
Okay. So when we made the agreement, it was 10 hours a month, I believe, at your rate.
Yes.
Rate.
Yes.
And the 10 hours, we're asking more of you than 10 hours. I think we're all probably aware of that.
Yes.
This isn't hitting. I mean, I guess I'm not surprised. So what you're saying is that with these special projects and more stuff, that we're going to have to take look at that agreement again and modify it because you're spending more time on Brown County issues.
Yes. And I do think, yeah, fair enough. I think that's right. And I do think that it should be something that's, someone that likes streamlined government, cost efficiency, I do think you need to look at it in a temporary way. Right.
Sure.
I think it needs to be temporary without an expectation of it extending for
Right.
an extended period of time. I think you need to look at it and then we figure out what we accomplish. If there's additional things, we've lined up some things to do over the next several months. Insurance is one of them that we probably need to tackle directly. And then after we get that done, we reevaluate and see what needs to be done.
Okay. Any questions? You understand?
I think we're on the same page.
Yeah, we are asking more of you than I ever really anticipated.
And me too. I wasn't, which is okay. I had to anticipate.
You'll talk to us maybe on Monday. I'm sorry, I walked right over you there. I guess I was just rude and I apologize, but we'll talk on that next Monday's meeting. Does that sound good?
Yeah.
Okay.
Yeah, I'll bring a short form letter back that says this is, I think, what it could be in terms of really just an addition of hours, but everything would remain the same under the existing contract that we have, but just add some hours and associated costs with that we can talk about at the next meeting in person. Okay.
All right.
Can we also look at getting that short form contract with these 1099 employees?
Yes, I'll have that with me for next meeting as well. That's on the to-do list. And I also have I have one other item, the quick claim. There's assisting. It's really beyond the county's purview, but I'm assisting the gentleman that wanted quick claim between. We talked about this a few weeks ago. I'm working on that this week as well. So those are my two action items outside of this meeting. And then if anything else comes up, you guys know where I'm at.
Okay. Appreciate you answering the phone. Thanks for we're gonna use you a lot. Thanks for helping us out and thanks. I mean, it's good to have some. Sound like you've got quite a bit of expertise in the health insurance and that's, I mean, it's reassuring to me nonetheless. So,
No, I appreciate that. I will make the comment. This is, I think I'm 750 public meetings in, working as either administration or county councilor or city attorney or representing government. So
okay,
it builds up over time. You go through enough things and you've done it for a while.
right, right. All right. Well, thanks a lot. Have a good rest of your day.
Thanks,
Thanks,
Austin.
guys. Bye, buddy.
So. That's all good. It's 2:15. All right, so we've talked about it. I would make a motion then to approve the 2026 insurance as presented here on our document. And then also to discontinue the county gap policy effective 1/1 of 2026.
I'll second the motion.
It's been moved and seconded. Is there any more discussion? Seeing none, all in favor say aye. Aye. Aye.
Aye.
Okay, motion carried, 3-0. That's done. Agenda, I was looking through at the email. Seems like Kansas Soybean reached out about the bridge meeting for next. Is that still workable?
So, what do you want me to do?
Okay, and then the same thing with K Camp then, because they wanted to zoom in at 9.
Yeah, that's fine. I will be here at 8,
Oh, there you go.
but then
Where's my-
1 o'clock, you think we'll still be here? Okay, at 1 o'clock on the 10th.
Okay, so K Camp is fine, but Dennis, I'm sorry, I looked at that completely out of. I guess we just need to reschedule. Do you want me to reach out or would you?
I can do it because I don't know what the budget looks like, so
Okay,
I'll email when we get done.
okay,
That was my fault.
all right, well,
You
and
changed it.
what a wonderful segue into next meeting is at 8. Yeah. The next Monday's meeting.
Okay.
So circle it, highlight it.
So that's go school meeting morning meeting, you're gonna be done by noon.
Unless you guys wanna do like a reset and come back at 1 for that, so we don't reset on it, but you. It's me, you guys do get this up then.
The canvas process to a new person is what?
You guys decide if provisional ballots count or not. And then the one that do count goes there, and then you do the. Certificate of votes cast for provisionals and just certify, the results of the election.
Okay, so you've done this before. How do you decide to count provisionals or not?
What statute,
Right.
basically shared by.
Okay, so it's all, okay, never mind. I'm sorry I looked this way.
Very much, all separated out.
Okay,
Let's go for the rate.
okay. And so the question is we start our meeting at 8:10, we canvass at 10. Do you want to reconvene after the canvas to finish the meeting?
I would say.
I just wanna be out by 1 o'clock.
You've got 1 o'clock.
Then
Bud,
we'll just reschedule the bridge.
or,
Yeah.
It's all right. He
I
can,
might make it by 2, I mean, I couldn't make shit, but.
No, because it will go a while. You guys will have questions.
we asked a lot of questions.
Okay.
Okay, so,
I'll just forward it. Can read it.
okay, thank you for that. And I know him, just blame it on me. That's fine.
Like on the things that it says that, but in the morning.
Well, you could, or blame it on me. Okay, all right, so we'll.
That's for
work that.
quick results, correct?
Yeah.
Right? That's,
Yeah.
yeah, I mean,
That's fine. Okay,
It
so,
works better the quicker I get out of here. the better.
yeah, no, that's all right. We can reschedule. That'd be just fine. Okay, so the K Camp thing's good. We took care of the alternative bridges. That's what that means about. Did we? Would it be helpful to have the road woman, our meeting like that? I don't think so. Okay. Yeah. Yep. Okay. All right, is there anything else that we need to look at?
What, for the book thing on Thursday, so I do some kind of agenda on the website, do we have like topics that we're gonna talk about, or just easier in general? Or for anybody, I don't know if there's something that you guys would manage.
well, I think originally insurance was gonna be a big part of that, and I think we've answered a lot of those questions already.
Mhm.
We already have kind of a path forward on that, so that takes away a lot of the agenda right there. I know we need to discuss, upcoming snow events, those kind of things, and make sure that we're prepared for that. I don't, like I said, I think the insurance was the number one thing that I had in mind, so. But there's always gonna be lots of questions, so I guess,
All right. Leave it.
so. During that work agenda, will we be able to talk about the company that we're using right now for the delinquent taxes in that work session?
You want to talk about anything, you just can't make any decision.
Right.
What,
I just trying to get some updates on where we're at on that.
what? I didn't hear it.
For the delinquent,
Delinquent taxes,
Oh, okay.
so. It's a growing number.
you just have each come down.
So on my notes from last meeting, I had personnel policy and we had some questions about the holiday pay when quitting. Is that something we need to talk about? You remember you brought that up?
Yeah, we just,
Put something in the personnel policy, if the last day falls on a holiday, you're not working the next day, you shouldn't get. paid for it.
Okay,
But that's
okay,
somehow.
okay. I'm just looking for things to talk about. If you're right, I think insurance was the bulk of it, but the part-time driver was. We can still spend that hour in meaningful
Sure.
discussion. But as far as giving her some guidelines, that's about all we can. Okay, all right.
And now the wellness has been, there's a couple things we wanted to update and, description and how they're handled. And so I wanna update that and then bring it to you, all. We can do it next meeting. Just making sure that people understand we need original documents with actual signatures, not digital. It's okay, format.
Okay,
Afraid of thing.
okay.
This election's pretty slow. I sat down, you guys maybe had 89 people, one person for early voting and 22 by mail, so. That was fine. DJ needs Bill and we get to, copy of the driver's license for the update. For the bank account, we just gave her the one you gave for it. Um,
She needs a copy of our driver's license.
Yep.
Yeah.
Updated, so.
Do you need that today or is that something to do in the work session?
I can get it on Thursday. if you want.
Thursday, okay. Always got it. All right.
Does it? Is it a possibility, because we said something about elections next year? Is it a possibility you guys are looking at like county administrator position? I don't know. Okay, I didn't know if that was something I know to research. It seems a little more in depth than out there this one, so I just want to make sure we're going. I don't need to look at them putting out.
I don't think so.
Oh,
No.
okay.
Yeah,
Okay, I think that's all I'm saying.
we're asking him a lot of questions about administration.
Mhm.
I think he's,
Yeah, I think if we didn't have somebody like Austin, then it would be possibly something we could look at, but I really don't believe we need it.
okay, okay. I know I'm trying not to call him because I know our meetings are lasting longer than they should. Now, part of it's because he gives very detailed explanation.
Sure.
But as someone who does that myself, I understand. And I appreciate, because I have to hear it a couple of times to process, and I just want to make sure I don't misunderstand it. So it just takes time. We are asking him, I feel like to do more than we originally set out to do. So I'm not surprised this is coming. What's that? Well, that's true.
Well, which brings me to my other.
Yes.
question, and nothing to do with me directly, but, he was gonna contact Pat Hughes about the. Member, the resolution to change like. When they renew and stuff, then we can give everything on that.
I haven't heard.
Because I think they have a meeting tomorrow. Yeah, it's not.
Okay. Okay. But I'll just send him, can I just send him a
Yeah.
text? I just,
think that.
no, I hadn't heard, but I've asked him to do some things and okay.
So I just need to be presenting some changes, to what they suggested before. Prior to the next couple weeks.
Any of you gentlemen have something? to
I just,
discuss?
just a quick update, we talked about sending somebody over and fixing the water leak in Fairview. We did that,
You got that done?
we got it done, it's about a $30 part, and then, of course, our labor. But I think that's exactly what we want to do in the future, where
I appreciate that.
instead of paying contractors, subcontractors to do work that we can do in-house, we need to make sure we're,
So did they replace the meter then too?
didn't replace the meter, they fixed the leak.
Okay, cause they were talking about, the city was talking about they needed to replace the meter. But then he was talking about doing fixing the leak too, so I.
So the meter, when they replace it, that's all done within their range. So
Okay,
the area that was dug up and repaired doesn't have anything to do with that. They can still do that at any time,
okay.
so. And the water was turned off anyways because of the leak, so,
Okay. Thumbs up.
yeah.
Yep, thank
Good
you.
job. All right, what else do we have? So we've got this work session coming. We still need framework for just like that. How do we get that idea from concept to it's fixed? And do we need to have some sort of written, do we need to have a process, policy, things like that? For instances like. How do you make that just happen?
Well, I guess, as we're made aware of the problems, which is, Tammy brought the problem to us, obviously they're talking to her. Then we make our decision and say, let's get it done, and then I follow up within the next couple of days, and make sure it's done.
Okay.
So they, when I talked to them, they were going to call Big Safe, did they call Big Safe when they done it or not?
They were supposed to, and I'm sure they did.
I
So,
mean. That's, when I talked to him, he was talking about doing that.
right, and that's why it wasn't done the next day, I'm sure.
Because it takes, I think, 36 hours. or 48 hours.
About 8 hours, so.
Mhm. So when last I talked to them, they were supposed to be getting that part done.
Okay. All right. Anything else?
I think that's it.
Yeah.
Yeah, we still got, revitalization thing.
Yeah, it's I haven't had a chance to work on the draft yet.
But
Okay. It's all right. It's election season.
like I said last time,
So you're not, okay, understood.
anyway.
We can talk about that in the work session if you want, Bill, on that. If you want to tell us, what you think.
You want to, now,
Okay.
do that.
Okay. Be another agenda item.
So part of it, yeah, I was gonna say, you'd add that to the agenda if you.
All right. Hey, what next?
That's, like, only thing. I don't know.
Okay, I would bring something up. When we had our, when we do the courthouse, what am I trying to say? When we open it up for, like we had that display on the east side courthouse, do we make sure that everyone knows that we allowed a demonstration? I mean, does that go automatically like to the sheriff's office and to the employees, like, so people know that that's happening? Okay. Wonder how we could do that so we make people aware that if there's, if there's gonna be a rally on the north steps of the courthouse, that the people that work here and the sheriff, everybody knows that it's going on.
So you want like an email or do you put it on the website?
Well, so Dallas mentioned an employees only section of, for county employee, is that right? You mentioned some, is there a way to make that so it's just sort of we just do it?
Not very, we only.
Oh. Okay,
We did. They have to log in with an account, so we created accounts and sent that out to everybody in the email.
okay,
But as far as I know, there's no way to send out a notification for them.
okay.
They would just have to know to check it.
So is there a quick and easy way to spread that information out that you could think of?
The department.
Okay, and maybe go to the sheriff too, so,
Yeah.
yeah, that'd be cool.
Seems simple enough.
It does, and I never would have thought about it had I not got a phone call and some questions and I, we just take care of that.
So that kind of parlays into the next thing. So when we grant a permit for somebody to set up here, there's a special usage permit, correct? Can we get a copy of that, what it looks like? Is it just, it's on the website? Okay,
It's a problem.
okay, great.
While we're on that topic. Does anybody know what happened here on? Why the courthouse is lit up, there's a bunch of cars. I don't know either. So
So-
it's like the first floor with, I guess, all the lights are on, and there's a bunch of cars parked on the back. And when I left this, I seen two long tables that I have no idea where, I didn't ask those. But then someone texted me after it was happening in the courthouse last night. I don't know, I don't have them, but calendars, I don't know what.
No, I'm first time. heard of
So
it.
normally that would have been under that special use permit, correct? And there wasn't one. So,
I don't know if anybody else knew about anything.
I could be wrong, but I thought I saw somebody from the extension office setting up on a table flag.
That's why I wondered, where the extension have older meetings. I look for
Possibly on the first floor of the courthouse. There are. If that's the case, I mean, I asked for permission to use the building on Saturdays and I don't find it important. And they didn't say anything, so until I see about it, we have no clue.
Well, that falls into that.
so who's the point of contact at the courthouse? That would be you, correct? So,
And then I have to present the agreement to you guys to approve.
okay. So it sounds like somehow that didn't take place. So who do we need to follow up with the FSA? Is it the extension office, you said?
It's like- After all, it's two tables and someone asking why the lights are on.
Dallas, why do you think it was the extension office? Did somebody tell you that?
No, I think I recognized one of the people setting up tables when I left at about 5.
Well, I can go visit the extension office and just ask. Just make sure that we have a protocol and
Let us know that you're.
sure. Okay, I'll do that.
All right, fair enough. Anything else?
I think that's it.
Okay, well, if that's it. We've got our next work session is Thursday. I have it at 2:00. Is that correct?
1 to 2.
1 to 2. 1 to 2. It's 1 hour, hard and fast. Schedule, and we've got a few topics to work out. And then the meeting immediately following that is Monday, the 10th at 8:10. And Bill needs to be gone, so we will accommodate that. Bill needs to be out of here. No problem. Okay, I appreciate this calendar too. This is gonna keep us straight. So if there's nothing else to come before the board, Bill?
this. There's a meeting in Jackson Heights or something on Thursday, I believe, from 5 to 7 about Highway 75.
Yeah,
It's been on the news, I think. That's where I heard about it anyway. It's nothing that's not been publicized.
I've already planned on making it.
That's thinking about it, might be. Thinking. And I attended Jackson, no, Emhoff County had their planning commission hearing last week. That was kind of interesting.
You went to that?
Austin, I control that first. Some people for it, some people against it.
Yep.
Okay, all right. Any more? Well, thanks for going to that. That's good. Any more from you?
That's it.
All right, well, I'd ask
See
for
you on Thursday.
entertain a motion to adjourn.
I'll make a motion to adjourn.
Second.
Okay, so moving seconded, all in favor, say aye.
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 Okay, motion carried. We're adjourned. Good job. Thank you.